Today, we're going to talk about the Salonpas-Hot Adhesive Patch, Medicated. This patch is used to help with minor aches and pains in the muscles and joints, like arthritis, backache, and sprains. It contains capsaicin, which works by reducing a natural substance in your body that sends pain signals to your brain. You can apply the patch directly to the affected area and it can be used up to 3 to 4 times a day. It's best to apply the patch at the first sign of pain for the best results. When using Salonpas-Hot Adhesive Patch, Medicated, make sure to only apply it to the skin and follow all the directions on the product package. You can use a cotton ball or latex glove to apply the medication to avoid touching it with your hands. Avoid applying the medication to the eyes, mouth, nostrils, or genitals, and if you do, rinse with plenty of water. Don't apply this medication to injured or irritated skin, and avoid using it immediately before or after activities like bathing, swimming, sunbathing, or heavy exercise. Also, don't bandage or wrap the affected area or use a heating pad, as this may increase the risk of side effects. After applying the medication, remember to wash your hands unless you are using it to treat your hands. Use this medication regularly at the same times each day to get the most benefit from it. It may take up to 2 months to work, so be patient and tell your doctor if your condition lasts for more than 7 days, gets worse, or keeps returning. If you think you may have a serious medical problem, seek medical help right away. You may experience warmth, stinging, or burning at the application site. If these effects persist or worsen, contact your doctor or pharmacist immediately. Be cautious to avoid inhaling the dried residue from the medication, as it may cause coughing, sneezing, watery eyes, or throat irritation. If your doctor has prescribed this medication, they have determined that the benefit outweighs the risk of side effects. Most people using this medication do not experience serious side effects. Stop using the medication and notify your doctor if you experience blistering or swelling at the application site, or increased or unusual pain. Although rare, a serious allergic reaction may occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects, contact your doctor or pharmacist. If you are in the US, call your doctor for medical advice about side effects. You may also report side effects to the FDA. In Canada, call your doctor for medical advice and report side effects to Health Canada. Before using Salonpas-Hot Adhesive Patch, Medicated, make sure to inform your doctor or pharmacist about any allergies you may have to capsaicin, capsaicin, hot peppers, lidocaine, or other local anesthetics that may be in this product. This patch may also contain inactive ingredients that could cause allergic reactions, so it's important to talk to your pharmacist for more details. If you have any health problems or are planning to have surgery, consult your doctor or pharmacist before using this medication. It's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products before having surgery. If you are going to have an MRI test, let the testing personnel know if you are using the patch. Some patches may contain metals that can cause serious burns during an MRI. Consult your doctor about whether you need to remove the patch before the test and apply a new one afterward, and how to do so properly. If you are pregnant, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding while using this patch. It's important to be aware of any potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Remember not to start, stop, or change the dosage of any medicines without your doctor's approval. Also, it's important to note that capsaicin is very similar to capsaicin, so it's not recommended to use medications containing capsaicin while using capsaicin. Always consult with your healthcare provider before using any new medications. If this medication is swallowed, it can be harmful and may cause serious symptoms such as passing out or trouble breathing. In case of an overdose or serious symptoms, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. It is important to keep this medication out of reach of children to prevent accidental ingestion. Always follow the instructions on the packaging and consult a healthcare professional if there are any concerns about the proper use of this medication. Make sure to keep all of your medical and lab appointments as directed by your healthcare provider. This will help to ensure that you are receiving the optimal benefit from using the Salonpas-Hot Adhesive Patch, Medicated. Following your appointments will also help your healthcare provider to monitor your progress and make any necessary adjustments to your treatment plan. If you forget to use the patch, apply it as soon as you remember. If it's close to the time for your next dose, then just wait and use the patch at your regular time. Don't use 2 patches at once to make up for the missed dose. Make sure to check the storage instructions on the package before using Salonpas-Hot Adhesive Patch, Medicated. If you have any concerns about where to store it, don't hesitate to ask your pharmacist. Always keep medications out of reach of children and pets. Remember not to flush this product down the toilet or pour it into a drain unless specifically directed. When it's expired or you no longer need it, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.